This is a really easy peasy question, and in which we have to see, okay, so what is the problem? The problem with cystic fibrosis. As soon as we hear the word cystic fibrosis, we know two organs are going to be involved, and this is the lungs and as well as the liver. Let's see. Its symptoms are presented in this question. So patients present with the epistaxis, or it could be the platelet disorder. And what else we have? We have got the bruisability, and we don't need to read the rest of that. Okay, so we know that this is the liver. Because in liver, we have like the vitamin K dependent epoxide reductase, which is linked to work on a extrinsic pathway, which includes these factors, right? So this is going to come them into the active product, and for extrinsic pathway, we see like the PT. So this is going to be increased because there's going to be like decreased in this whole process. So this is like the fat-soluble vitamin like these. When there's going to be deficiency of these factor won't be formed. So you have a lot of bleeding problems. Like it could be the mucosal bleeding, it could be the GI bead, it could be the any other leper and all that stuff. So that's it. So this is, we are not able to activate because we don't have vitamin K. We don't have these vitamins. These are fat-soluble vitamins. And we have the epoxide reductase inside the liver. Liver is damaged because of the cystic fibrosis. So factor 2792 would be deficient, which is going to increase our BT. That is the extrinsic factor, and that's it. Vitamin C is not a fat malabsorption vitamin. Right, and you have like the gum bleed, you have the perifollicular symptoms, and okay, this is ADAMTS13 deficiency, which is like the TTP. All right, so you have like the kidney problems and the sinus problems and like the fever. Okay, for this we need to have a spleen, which happens in a sickle cell anemia or like a leukemia and cancer. In 3, coagulation factor happens in a DIC or like the malignancy, the sepsis or like the trauma. So that's the story. And also we can have like the ADEK deficiency, which is like the fat-soluble vitamin deficiency in antibiotic use. We can have that in celiac disease. We can have that in biliary atresia. We'll have that in any GI disorder, which could lead to the malabsorption.